discussed about the recent outbreak of coronavirus. Since there is a lot of information and stories doing the rounds, it is easy to get confused. I am Dr. Kalpana Gautam, aim to clear all your doubts and present you with the accurate information. So let's start by knowing more about the virus first. Coronavirus. What is coronavirus? Coronavirus is a virus that belongs to the family that causes infection like common cold, severe acute respiratory syndrome, that is SARS, Middle East respiratory syndrome, that is MERS. A new outbreak of coronavirus just erupted in 2019 in Wuhan, China. Since then, it has spread to several countries around the world. So, what are the common symptoms? Most common symptoms are fever, dry cough, and tiredness. These are very vague symptoms. The less common symptoms are pain, aches, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, skin rash or discoloration of fingers. So what are the serious symptoms? Difficulty in breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Seek immediate medical attention if you have any of the serious symptoms. And remember, always call your doctor before visiting. Generally, people with mild symptoms who are otherwise healthy should manage their symptoms at home. On an average, it takes around 5 to 6 days when someone is infected with virus for symptoms to show. However, it can take up to 14 days. So how can you prevent? Stopping starts with you. Wear mask. Clean your hands. Manage safe distance. Get vaccinated. So, to prevent the spread of COVID-19, clean your hands more often, preferably with water and soap. If you don't have access to the water or soap, look for the hand rub that is alcohol based, having alcohol more than 60%. Always maintain a safe distance with anyone, especially who is coughing or sneezing. Wear mask when physical distancing is not possible. Do not touch your eyes, nose and mouth when outside, and especially when you have touched anything. Cuff your nose and mouth with your hand bent elbow or tissue when you cough or sneeze. Monitor your health daily. Stay home if you feel unwell. In case you feel your symptoms are specific to coronavirus and there are different tests that can be done, like first of all, swab test. In this case, a special swab is taken from your nose or throat. Second, nasal aspirate. In this case, a solution is injected into your nose and then sample is taken with a light suction. Then, third, tracheal aspirate. In this, a very thin tube with a torch is known as bronchoscope is put into your mouth to reach your lungs when the sample is collected. Fourth, sputum test. When the sputum is thick and accumulated in your lungs and it comes out with cough. During this test, the doctor would advise you, or the lab investigator would advise you, to cough up sputum in a special cup or swab to take the sample from your nose. The fifth test is the blood test. In this, the blood sample is taken from your vein in the arm. So, what are the basic tests generally done for coronavirus? First is RT-PCR. As we all know, very known test nowadays, RT-PCR. RT-PCR is a type of nucleic acid amplification testing. It is commonly used to assay the RNA from upper respiratory tract, and it is a preferred initial diagnostic testing for COVID-19. Nasopharyngeal swab, nasopharyngeal specimen from both the nares, the nasal mid-turbinate swab, the nasal or nasopharyngeal wash or aspirate, oropharyngeal swab specimens, or the saliva specimens are taken out for this test. So, in this test, it detects the so what if your result, your report comes positive? Definitely you have to go further depending on the state or the symptoms. If your symptoms are mild, you can take your treatment at home with home isolation. If your symptoms are wild, you have to look for your nearby doctor or on-call doctor. Secondly, if the report, the RT-PCR comes up negative, which is very common in this second phase in India, where the most of the patients who are complaining of the symptoms of COVID-19, they are coming up with negative RT-PCR test. In this case, we have to perform the test again, and for to repeat the test at an optimal time just to confirm the diagnosis. The optimal time is generally 24 to 48 hours after the initial test. So, what are the testings done, investigations done in hospitalized patients? In hospitalized patients, generally imaging testings in done if there is no finding in RT-PCR. If there is report is negative, then for the patients who present 3 to 4 weeks into the course of illness, the serological test may be informative. What is serological test? Generally, IgG, IgM are the tests done in a serology. Liability of serological test depends specifically on the duration of illness. So, in RT-PCR, the report generally shows CT value, that is cycle threshold value. What is cycle threshold? It is a number of cycles in RT-PCR assay needed to amplify the viral RNA to detect the detectable level. So, for example, just viral RNA level in specimen, low CT values reflective of higher viral levels. So, what is rapid antigen test? Rapid antigen test is generally when the test RT-PCR could not detect the virus when the virus load is very low. In this case, the rapid antigen test is done, but it is not as sensitive as RT-PCR test. Here in this case, the viral proteins in respiratory samples is detected. The advantage is the reports comes in minutes. They don't take it longer time, and it is simpler to perform than RT-PCR. So now, in settings where RT-PCR is unavailable, these antigen tests are very helpful. And remember one thing, they should be performed within first to 7 days of symptoms. If confirmatory testing with RT-PCR is performed, it should be done as soon as possible after antigen test, ideally within 48 hours. So, thus, negative antigen test cannot used to indicate that the virus infection, the person is not infectious. So, what are the antibodies? There is serology test. These tests are antibodies produced by the immune system in response to COVID-19, SARS-CoV-2. It is not a preferred test to diagnose the current infections. Antibodies, they don't show up for almost 1 to 2 weeks after you first became sick. So we may miss the early infection. The other tests are viral culture, which are done for the research purposes only, and the immunity, mainly the interferon gamma release assay. So, upon suspicion of COVID-19, the control measures should be implemented, infection control at home and in healthcare settings. will be discussed in detail in the next video. If you like the video, please like, share and subscribe the channel. Thank you for watching.